Hello and welcome to today's MSc Sports Medicine, Exercise and Health Open Day. Thanks very much for joining us. My name is Barry Schooling. I'm the Marketing Recruitment Manager for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We're hoping this session will address those course-specific questions you may have and will help you gain an insight into what it's really like to study on this exciting MSc programme. I'm delighted to welcome today's speakers, Courtney Kipps and Sian Massey, who will provide you with a summary of our Sports Medicine, Exercise and Health MSc programme. And there'll be a Q&A session, so there's plenty of interactive opportunities for you to join in throughout today's session. The session is being recorded and will be made available on the website following today's event. But we're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. You'll see this Q&A button with the two speech bubbles at the bottom. In fact, if you want to sort of just introduce yourselves and say kind of who you are, if you're a doctor or a physio or whatever your profession might be at the minute, we're interested to know and to hear from you. But yeah, likewise, please submit your questions throughout, and what we'll do is we'll take them all at the end. So just to introduce the speakers, we have Courtney Kipps. Courtney's a professor of sport and exercise medicine and co-lead of the MSc programme in sports medicine, exercise and health at the Institute of Sports, Exercise and Health at UCL. Professor Kipps will be presenting a short talk on why you should consider studying on the course, and if, like himself, you're passionate about sport and exercise medicine, why it's the course for you. We're also joined by Sian, who's a teaching administrator on the course. So before I hand her over, again, just like to say thank you very much for joining us. And yeah, Courtney, over to you.
Thanks very much, Barry. Can you hear me okay?
Yes.
So thanks very much for the introduction, and hello, everybody. Welcome here. Now, I can't see you because this is a webinar, but I'm very interested to know who's on the call and really tell me a little bit about your backgrounds, what your background discipline is, and perhaps whether you're in the UK or overseas. It's useful to know who I'm talking to as I go through the talk. So do fill in something in the chat whilst I start sharing my screen. And looks like nobody's yet filled anything, in which case I will get started. You're very welcome to put your hand up and ask me a question. Abhinav, did you have a question you wanted to ask? Barry, I presume all the questions come through the chat, do they? Okay. Well, I won't see the chat whilst I'm talking. Barry, you do interrupt me if there's something which, sorry, Abhinav, I get your point. It's the Q&A bit where your answers are going to come and your questions. So apologies, I got that wrong. Barry, interrupt me, please, if there's something which it would be helpful for me to address as we're going along. Otherwise, I'll keep talking.
Will do.
Okay, so that's me, and you're all interested in sports medicine, exercise and health, which is the master's course that I run here at UCL with my colleague, Professor Eleanor Tillett, and beside me is Sian Massey, who's our excellent administrator. But really, the opportunity now is to tell you why you should be studying sports medicine here at UCL if you're passionate about sport and exercise medicine. I'm going to run briefly through the specialty. I'm going to run through what you can do with your degree when you're finished, what you will learn whilst you're here, and why you should consider studying at UCL, and then what you should do next. Now, I imagine that some of you already know a lot about this if you spent time researching it and you're interested in it, but I'm going to remind you then that sport and exercise medicine is one of the true multidisciplinary specialties in the medical fields. We have working with us physiotherapists, doctors, sports scientists, sports therapists, rehab therapists, strength and conditioning coaches, podiatrists, osteopaths, chiropractors. We've got a whole team of people in a sports medicine field all working around the same athlete, getting that athlete as strong as they possibly can be so they can perform to their best, whether that's with an elite athlete or a weekend warrior, or just somebody who wants to get back on their feet after an operation or get themselves fit again when they've been unwell. all of these members of the team work together with the same ambition and the same intention all around that same patient. The specialty has different organizations, BASM and the ACPSEM for physiotherapists, BASRAT for strength and conditioning coaches, and BASIS for sport and exercise physiologists. And I might let you know that BASM and the Faculty of Sport and Exercise Medicine are likely to be joining forces in the near future. And so those in the UK who are interested in sport and exercise medicine will have a very big and impressive organization representing you outside of UCL. When you've done the course, where will you find sport and exercise medicine graduates? Or perhaps, which may be more meaningful to you, what could you end up doing after this course? And that is, for most people, it's going to be running a clinic. In a clinic or running a clinic, a sports injury clinic, a sports medicine clinic, looking after medical problems in athletes or people exercising, or perhaps in exercise medicine. Some of you, perhaps many of you, will be wanting to work with a team, whether that's your local team, whether your Sunday league football team or a professional rugby team or a national team, working with a club, a national governing body. As an example, all the Olympic sports in the country, all the sports in this country have a governing body who set the rules and run the regulations, but they also have a medical team at the top who make sure that the medical teams on the ground are doing things in a standardized, effective and efficient way. And each of them have a chief medical officer and a chief physiotherapist and a chief scientist working together to provide the support for that sport. Some of you will be working in research. You may be interested in research now. You may be interested in research when you get to the end of your MSc, because those of you who do an MSc as opposed to a postgraduate diploma will dedicate a full third of their course to a research project. And we have some great research projects here at the Institute of Sport, Exercise and Health, which is where we run our course from, where you'll be working with PhD students and a variety of external and internal researchers all involved in sport and exercise medicine research. Some of you might be doing what I'm doing, which is teaching. I started off in teaching when I finished my master's several years ago. In fact, most of the faculty have done a master's either with us or elsewhere, but they've all gone through this process that you're about to go through. Some of you will go into being a clinician, a sport and exercise medicine doctor or physio or other on an expedition. And indeed, just last year, a couple of our students did their research project as expedition medics on trips up to Mount Everest. Some of you will work in events, whether that is an event like the London Marathon or an event like the Commonwealth Games that happened in Birmingham last year, or the Olympic Games or the Rugby World Cup or Football World Cup. Those events have a very different way of running than the routine weekly matches in a league. So the events require doctors, physios, clinicians. They require them on the ground, supporting the athletes. They require them in the management, setting up the logistics and administration for the event. Some of you might end up advising. Who might you advise? At the very top, you might end up advising the government. Several of our staff presented to the House of Commons Select Committee last year on concussion in sport. And there's many other ways that one can be advising, whether it's to your local authority or to your local club, giving them advice on how they might best look after their athletes. So knowing that, I hope I've told you all the exciting things that you can be doing in sport and exercise medicine, but actually let's look at things in a more practical aspect. What will you learn whilst you're here with us? And that is, the majority of your time, you'll be doing sports injury diagnosis and management. Now we have 4 sports injury modules: lower limb, upper limb, head, neck, and spine, and rehabilitation. You'll be doing injury prevention. Injury prevention is an emerging and exciting topic. It's always been there, but for a long time, people didn't really think too hard about it. They thought about how to manage the injuries. Now we're getting better and better at managing injuries. We've also taken a step back and said, how do we prevent injuries? Because of course, prevention is better than cure. And if we're encouraging people to participate in sport, we should also be thinking, how do we look after them? How do we reduce the chance of them being injured or being unwell? I mentioned rehabilitation, and we have one full module on rehabilitation from sports injuries. We also have a module where you'll be learning how to prescribe exercise or physical activity as a medicine. There's a full module on exercise physiology, and that's a tough module because there's a huge field of exercise physiology, which we're going to cram into 12 weeks. But it's really important, and it's also very, very interesting. Some of you will learn the sports medicine that's relevant to teams and events. And some of you will learn the rehabilitation. Those two modules are optional modules, and you choose one or the other. All of you will learn the principles of research, and some of you who do the master's as opposed to postgraduate diploma will do a research project, as I've already mentioned. But perhaps a more important question then is, how will you learn at UCL? Well, we have several options. For perhaps a third of you, you'll be campus-based, and this, of course, is a choice. You can be campus-based, or you can do it via distance learning. About a third of our students are campus-based students. They're learning on-site at the Institute of Sport, Exercise and Health on Tottenham Court Road. And 2/3 of our students are distance learning students. Campus-based students will do it usually over 1 or 2 years, 1 year full-time or 2 years part-time. And as it says on the tin, part-time is 50% of the week learning. Distance learning students can choose full-time or part-time, although if you do decide to go down that route, a full or part-time distance learning, I'd like you to have a conversation with me beforehand, because that is quite a hard task. But most of the distance learning students will do it over 3, 4, or 5 years, because we know that our distance learning students select that method of learning because they've got other circumstances in their lives, which means they can't get into London to come and learn in person. And many of them are full-time, working in a full-time career, or have families or other caring responsibilities. And so balancing the workload with work and caring is important. Therefore, most of our distance learning students will do it over 3, 4, or 5 years, doing perhaps a module per term, rather than a full-time campus student who will do 4 or 5 modules per term. Those are the bits that I've just mentioned. But now, why should you consider UCL? Well, you probably already know this, but I'm going to tell you anyway, that UCL is the top university in the UK for research, and it's in the top 10 of the world rankings internationally. If you want to know more about that, follow that link about UCL. I imagine you've probably already been there, and that's why you're on this call. But you should also know that the studying happens at the Institute of Sport, Exercise and Health, known by its abbreviation as the ISEH. The ISEH is an internationally recognized sports medicine center. It's the center for sports medicine in London, if not in the UK, and is part of a global network of sports injury research centers. You'll be taught by a passionate and expert faculty who are experts in what they do, who all have a background in different aspects of sport and exercise medicine or physiotherapy. I, for example, have been the chief doctor for a professional rugby team for 10 years. I'm the assistant medical director at the London Marathon, and I'm going to be a doctor at Wimbledon this year. So you've got people like me and the rest of my team who are doing sports medicine on a daily basis, and will be teaching you exactly about what they know. We'll also be involving a lot of guest lecturers, and those guest lecturers may be local, national, or even international experts. We have a wide range of assessments to suit as many different learning styles as we can cover. So those assessments will be exams, there'll be multiple choice exams, there will be OSCEs, objective structured clinical examinations, which some of the doctors and physios may already be familiar with. There'll be presentations, individual presentations, group presentations, there'll be posters, there's a research project, there are vivas, there are essays, there are editorials. We try and give everybody as many different ways to show their learning as best as they can. And then finally, what should I do next? Well, ask questions, and that's what this is set up for you to do. Ask questions of me, ask questions of Sean. Come back to us afterwards if you've got questions. You're welcome to do so by email. If you have a chance, go on a pitch side course, pitch side medicine course, because we're not going to teach you that bit. Why are we not going to teach you that bit? Because because there are certain qualifications on pitchside medicine which you are required to have in this country in order to work in professional sport, and that to be a team doctor or physio or a match day doctor or physio at a professional football or rugby match. And those organizations, the RFU for rugby and the FA for football, run their own pitchside courses, and they give you a qualification. And therefore, if we taught you that, you then have to go back and do that again. And therefore, we're going to give it over to them, the experts, to do that little bit. If you go on that pitchside course, you will then meet a whole lot of other people, and you'll be given opportunities. You will have opportunities presented to you where you can go on and learn, use those skills. It'll also be helpful for you to start volunteering at events. Volunteering is going along and offering your services, maybe shadowing to begin with, but offering your services, not expecting to be paid because you may not come with any skills just yet, but just saying, can I come and help? Can I come and be there? Can I come and absorb? Can I come and learn from you at your marathon, at your match, at that tournament? Because once you've spent a bit of time there, they will get familiar with you. They'll be comfortable with you. The teams, the players, they don't like having unfamiliar faces around, but once you're familiar to them, they'll then ask you back when they need some extra help. So that's the way you get your foot in the door. Spend a bit of time reading the journals, the British Journal of Sports Medicine, for example. Spend a bit of time looking at their articles, which you can find online with the ETOC, Electronic Table of Contents. And if you go to the British Journal of Sports Medicine or any other journal and you subscribe to their ETOC, you'll get a weekly or monthly email come through with the list of papers in that journal, and you can click through and follow through and read them. So start reading the journals. Have a listen to any of the popular podcasts that talk about sports medicine aspects. Subscribe and read and even participate in some of the forums. Ask questions in those forums and people will reply, and they will give you the support, the help that you need, give you the answers you need. Twitter has its pros and cons, but certainly one way is to keep up to date with what's happening. Don't be too persuaded by the personalities involved, but do pick up the papers that come through, and that's one additional way to see what's happening, keep abreast of what's happening, and go along to some of the conferences. The sports medicine, the physio conferences. There's a good few every year in this country. There's a good few overseas, and they are all have their experts, and they're all great networking opportunities and great learning opportunities. For interest, the next BASM conference is in early October in Manchester, and you can already start buying tickets for that conference. But if you haven't already done so, please submit your application. Without that application, we can't accept you. Submit your application. And if you need help with submitting the application, if you're stuck and you can't move forward, do ask us and we may be able to point you in the right direction. So there I am at the end of my talk. I've gone through a bit about the specialty, and I hope you already knew that, but I hope it's helpful for you to have heard what you will learn and how you will learn at UCL and what you should do next. So I'm done, and I'm very hopeful that you're going to put through your applications and I'll get to read them in the near future. But at this point, I'm going to stop talking and pick up any questions that might have come through whilst I've been talking.
In the meantime, just a quick update. Regards to applications, at the minute, the closing date is the 30th of June. So we're kind of the latter stages. So please do get in touch if you have got any questions before we sort of get to that deadline. We'll send an email following this with contact details. But yeah, please do use this opportunity while the team are online. Submit the questions by the Q&A button at the bottom of the screen. In the meantime, while they're coming through, perhaps Courtney, could you maybe say a little bit about the current cohort, maybe what some of the current cohort are up to in terms of where they're working or who they're working alongside?
Well, I should tell you a little bit more about the cohort. We have 40 full-time and part-time students at UCL. We have 60 distance learning students. We also have a couple of sister courses. We have a master's in performing arts medicine, and we have undergraduate courses in sport and exercise medical sciences and an intercalated BSc for medical students in sport and exercise medical sciences. So altogether, we're nearly 200 students based at the ISEH coming in on different days. The postgraduate MSc students come in for lectures on a Tuesday and Thursday from late September. So the induction week is the week of the 19th, 20th, 21st of September. Those aren't the exact dates of the induction, it's just that's the week that I'm referring to. And then the lectures start the week afterwards. They go up until mid-December and then start again in the second week of January after some exams in early January. Go from early January to late March, a couple of exams in late April after the Easter break. And then the rest of the term is for your OSCEs and for your research. And those all take up a lot of time. So I mentioned that the research is for the MSc students, that's a third of your module. And essentially for that third term, you're going to be spending most of that time on your research, although ideally you will have spent some time working on it beforehand. And we'll give you a lot of support along the way for that. So I've just seen there's a couple of questions there. And Miguel said, I just want to know if it's mandatory to have 1 year clinical experience post-graduation to apply to the program. And the answer to that is yes, please. And by that, I mean, you've completed your undergraduate degree and you've then spent a year or more working in that field so that you come to us with a good understanding of your discipline. And you're able to bring with you your knowledge and experience from your discipline in your environment. What we found in the past before we put this into place was that we would have students coming through who've done undergraduate courses and then coming to do a master's, but don't yet know what the expectations are, how to apply it in a real life setting. So by coming to join us after you've spent a bit of time working in your discipline, you're then able to use what we learn, what we teach you and what you'll learn in a more effective manner. So yes, that is mandatory. We can talk about that more if that helps. Peter has asked, sorry, that's not a question. No worries about that, Peter. It's been recorded, so you can pick that up afterwards if you want to. Is there a public health component to this course? And the answer to that is not public health per se, but we have 2 or 3 areas where public health comes into it. The first is utilizing exercise medicine and physical activity as a health tool to learn how to prescribe exercise to treat and prevent chronic diseases. There's an opportunity in that module when you do an assessment one of the assessments will be to create a program that could be delivered in a community setting. And that, of course, is the way that public health works, is setting up those kind of programs. And similar to that in the injury prevention module, there's another group task of putting together an injury prevention program for an organization. And that too utilizes public health concepts. So no official public health components, but those aspects are part and parcel of it, wrapped up tightly within it. Leo, what's the difference between sport and exercise medicine and physiotherapy? Can I be employed as a physiotherapist with a sports medicine qualification? That's a very good question, Leo. So this course does not teach you to be something that you are not already. By that, I mean, when you finish this course, you're not going to be able to call yourself something different. If you are already a physiotherapist, you will still be a physiotherapist, but you'll have extra knowledge and learning and skills to apply in your physiotherapy work and service provision. If you're a doctor, you'll still be a doctor, but just with extra skills and qualifications. If you're interested in becoming, so let me go back a step. the sports medicine aspect of the title doesn't allow you to call yourself a sports medicine professional. You're still a physio or a doctor or an osteopath or a sports scientist, but you've got extra skills and qualifications. If you're thinking to yourself, I would like to work in one field or another, I'd like to work as a physiotherapist, I'd like to work as a sports physiotherapist, for example, then the best way forward would be for you to apply to physiotherapy school, get your qualification in physiotherapy, do your 1 or 2 years postgraduate qualification work experience, and then come and learn with us. When you're already a physiotherapist, then that's when we can teach you how to use sports medicine skills in your field in physiotherapy, or as a doctor, or as a chiropractor, osteopath, etc. So this course doesn't give you employability skills that you don't already have. It helps you go up the career ladder in your discipline. I hope that makes sense. Do ask again if I haven't explained that clearly enough. Abhinav, how many physical classes do you have to attend in a month for a full-time MSc? Abhinav, the classes happen all day on a Tuesday and all day on a Thursday. Each module is 12 weeks long. Each term there's 4 modules. So you can do the maths, but rather than think about it per month, it's per term, from end of September to end of December, beginning of January to the end of March. Those are all the teaching times. And so, of course, if you're a master's student and you're only coming in on a Tuesday and a Thursday, you might then be tempted to say, oh, that means I've got 3 days free and I can go and do something else with those 3 days. But of course, you're a full-time student, and the full-time student requires you to do a fair bit of learning. And that learning is self-directed learning. You've spent some time listening to the lectures, and you go back and you reflect on the lectures, you make some notes. We will give you lots of learning resources for you to look at beforehand, so that when you come into the lecture, you already have an understanding of those concepts, in which case you can use the lecturer, the expert lecturer, to help you build on those concepts. So we're not using the lecturer to teach you the basics. We're using the expertise of the lecturer to help you build to a higher level. So those other days during the rest of the week, the Monday, Wednesday, and Friday for a full-time student, those days we expect you to be learning on your own or with your colleagues, but at home, doing your revision, doing your preparation, doing your assessments, attending clinics, etc. So learning out of teaching hours. And that is the same with any masters in any discipline, that there is a balance between core taught hours and self-directed learning hours. Django, in terms of pitchside external qualifications, rugby, football, do they carry over to other sports? If not, are they recognized pitchside courses specific to combat? They do indeed carry over to other sports. In particular, the RFU course, rugby's PHISIS course, which is PHISIC, I think I've got that right, pre-hospital immediate care in sport, PHICIS. Pre-hospital immediate care in sport, is for any contact sport. And so combat sports will be exactly the same. It's how to manage serious, acute, significant injuries in the field or on the ringside. So yes, indeed, if you're thinking about that, I would go on the RFU course. The FA course I haven't done. I don't know to what extent it goes into injuries in neck, upper limb, etc. But certainly the RFU course does, because rugby players do that. And so there's many participants of those courses from other sports. Peter, are many physios using point of care ultrasound in sport, or is this mainly the medics? Are many? Well, some are. I don't know how to work out how many of them. Certainly some of them are. We're not going to give you a qualification in ultrasound. We'll show you ultrasound and we'll let you use the ultrasound machine here and there, but we're not going to test you on it, because that is a much bigger course. In fact, many people will do a master's degree in ultrasonography to be able to do so. If you're interested in using ultrasound, you do need a lot of training to do so. Is it mainly the doctors and physios will do so? That's a big debate, and we can talk about that for a while. I've used ultrasound for a long time, and I don't use ultrasound very often anymore because I've got expertise in the radiologist beside me who can do it better than I can. Tyrone, is it possible to do distance learning but over 2 years? Yes, indeed it is. So that would mean you're doing part-time distance learning. But remember that part-time is 50% of the week. And so you need to be prepared that for half the week, you will be dedicating half your week of the working days. So 2.5 days a week at least dedicated towards your course. And that's not just the lectures and the assessments, not just the lectures and the learning around that particular module. It's all the same as we've just been talking about. It's the preparation for the lectures, it's the revision notes afterwards, it's preparing your assessments, it's attending clinics. So it's something that we've introduced in the last 3 or 4 years, but we do want people to recognize that part-time distance learning does require 50% of the week to be dedicated towards your learning. And we can talk about that more if you want to. I'm very happy to do so. It is possible. You just have to be prepared for that 50% of the week.
So that's the last of the questions that we've currently got in. If you do have any more questions, please do jump in and let us know in the Q&A bit of the chat. But it's been some great questions so far. I mean, is there anything else maybe in terms of advice for applicants, anything you'd kind of look for in their application, the personal statement or anything like that might be worth covering?
Fair question, Barry. What we're interested in knowing from you as applicants is what you'd like to do with your degree and how you feel it will help you get what you'd like to do as a career and how you feel this degree will help you get there. And sometimes that can be very informative, and sometimes actually it allows us to say that if you're interested in certain aspects, you might be better off doing another course rather than this course. And for those who evidently want to do this course, that personal statement is extremely helpful. You know, what we don't want is somebody to take the course because it sounds interesting, but then to find out when they get there, perhaps when they're halfway through, that actually it wasn't going to get them, not going to get them to where they want to go in their career. Because then it's a bit of a waste of time and in effort, time and money indeed for those particular students. So I'd rather have those conversations beforehand. And if it's clear from your personal statement, we can discuss it with you and work out if this is indeed the best way forward for you. In terms of your applications, one of the reasons why people sometimes get stuck on the applications is if a reference comes through from a personal email address. We can't accept personal email address references. So when you ask your supervisor, your mentor, your professor, your boss for a reference, please ensure they send it from an institutional email address like their university or their company or their hospital, or do it on headed paper. Submit it on headed paper from their company, university, clinic, hospital, etc. We absolutely need those, and often they get bounced, unfortunately, sent back and asked to be redone, and that can be a delay. Okay. The other bit that sometimes catches people out is one that we've already mentioned, that it is mandatory to have a year's worth of postgraduate work experience after you graduate, not internship whilst you're doing your undergraduate degree, but after you graduate. And that's another mandatory requirement.
One more question just come through.
Django, from a research perspective, are dissertation projects published? What PhD might this lead on to continuation of MSc dissertation? Could there be potential for guest lecture opportunities rather than full-time teaching? Sure, all of that is possible. Dissertations aren't expected to be published, but we would like you, if you can, to get them to a level where they can be published. And every year, we will encourage people, once they've submitted their dissertation, we will encourage them to work on it further, to get it ready for publication. And every year, some of them do. It's not a requirement of the course for it to be published. Some MSCs internationally will only let you pass if you have published your dissertation. But that's, as anybody who's tried publication will know, that can be 2 or 3 years of a lot of backwardsing and forwardsing. And so we don't make that an expectation. We would ask you to submit your dissertation in the format of a publication. So if it was good enough, you simply send it on to a journal straight afterwards. But that's not an expectation. We're going to be marking your dissertation on the work you've done for an MSc. And for some people, that's all they want. And that's fine, because what we want you to learn is how to prepare the research project and how to write it up. If you've learned that and we've done our bit, we'll support you to publication. So we won't let you fall off there and not let it go, but it's not an expectation. Some people will go on to do a PhD, but that's not all that common. Many people have used this as a stepping stone to get onto the career ladder, and they then get on the career ladder and might or might not come back. For some people, they're already on the career ladder and they simply wanted for more learning and they want to get onto a PhD. And most PhDs require you to have done an MSc beforehand. So for those who are interested, there certainly are opportunities. And yes, if there is expertise, then they may well be invited to come back as a guest lecturer. Many of our guest lecturers have been an MSc student themselves in the past. So that opportunity, of course, is there. Tyrone, in regards to 1 year experience, if I'm coming to 1 year experience in 2 months, is it still okay for me to apply? Yes, Tyrone, because when you start the course in September, you will have done your 1 year. So absolutely, yeah, that's perfectly acceptable.
Yeah, please do submit if you do have any last minute questions. In the meantime, I will just say again, just what we sort of said at the beginning, the application deadline is the 30th of June. So if you do have any questions following this, we will share Courtney's details. So please do submit questions by email if there's something that comes to you kind of after the event. There will still be an opportunity to sort of ask and to feedback. But actually, if there's no further questions, then I think we'll leave it here for today. So yeah, please do follow up with any questions by email, and also we'll follow up with a feedback form. So please let us know your feedback on the event. Yeah, thanks for your comments, thanks for your questions, thanks to Courtney, thanks to Sean for joining us, and yeah, hopefully we'll see you all in September.
Good, thank you all.
Cheers, take care, bye.
Bye-bye.